Well, good morning or good afternoon, everyone, depending on where you are in the world. I'm Christopher Mikton. I work for the Demographic Change and Healthy Aging Unit within the Department of Social Determinants of Health at the World Health Organization headquarters in Geneva. I'd like to start by thanking Professor Hussain for inviting WHO to participate in the launch of MENARAH today. Next slide, please. Yeah. So, as previous speakers have mentioned, the world population is living longer. The world population is aging and at a pace really never seen before in the history of humanity. And this is having all kinds of far-reaching implications, especially for the health sector and the long-term care sector. Just some examples. It's projected that by 2050, the population of people 60 and over will have doubled to 2.1 billion. Population of people 80 and over will have trebled by 2050. And about 80% of older people will be living in what in the UN world we call low and middle income countries in 2050. So population aging is in no way only a problem of high income countries. Next slide, please. And this map, which I hope you can see, shows on the left the proportion of the population 60 and more in 2015, and on the right, projections for 2050. And if you look the Middle East and North Africa region, you see, for example, Iran, 2015 had less than 10% of the population over 60. It's projected to have over 30% by 2050. Another example, Morocco, Algeria, Libya, less than 10% in 2050, between 20 and 24% in 2050. So in the region, as in the rest of the world, there is really rapid population aging taking place. Next slide, please. And in response to this population aging and the far-reaching consequences for society, WHO and other UN partners are in the process of launching what we're calling the Decade of Healthy Aging. Next slide. And little aside, just for kind of clarification of concepts, healthy aging we define as the process of developing and maintaining the functional ability, even in the presence of disease or disability, that enables well-being in older age. And functional ability is really the outcome of an interaction between intrinsic capacity, intrinsic mental, physical capacities, and facilitators and barriers in the environment. Next slide. So the Decade of Healthy Aging is really an opportunity to bring together governments, private sector actors, academia, professionals, international agencies, civil society organizations for 10 years of focused action to improve the lives of older people, improve the lives of older people's families and their communities. Next slide. And this decade has four main areas of action. First deals with ageism, really changing how we think, feel, and act towards age and aging. Second one deals with communities, developing communities in ways that foster the abilities of older people. The third concerns health, delivering integrated care and primary health services responsive to older people. And the fourth was long-term care, providing older people who need it with access to long-term care. We're also developing a platform which will connect stakeholders and enable work on a number of cross-cutting issues. First of these is listening to older people and engaging them. The second is nurturing leadership and capacity building in the area of healthy aging. The third is connecting stakeholders to share and learn from each other. And the last is strengthening data, research, and innovation in the area of healthy aging. And really it's these last, well, especially the last one, but these cross-cutting enablers that we really would welcome the help of MENARAH on. Next slide. Just an example of an activity that we've started to conduct to engage older people. It's a participatory video voice project taking place in all regions of the world. In the Middle East, it's taking place in Jordan. And it'll demonstrate how older people can be engaged and bring older people's voices and their lived realities and perspectives to the heart of this decade of healthy aging. Next slide, please. And this is the process of the endorsement of the decade. The decade hasn't yet been launched. It's in the process of being endorsed. It was endorsed by the World Health Assembly in August, and now will be considered by the General Assembly of the United Nations in December. And then we hope or anticipate that it will be adopted and formally launched then in January. Last slide, please. And we really welcome the launch of MENARAH and really hope to be able to collaborate with this network throughout the decade. Thank you very much.